Hello, my name is Armando Adano, and this is the assignment for week 3 for the upper extremity mobilization. And this is under the class of peripheral joint mobilization by Dr. Karen Bastillo. So I'll be demonstrating the mobilization in response to the case for week 3. And this is a case of a patient, 38-year-old, who was involved in a motor vehicle accident. This patient sustained a severe elbow fracture requiring ORIF, and the patient was casted for 7 weeks, and the patient is 2 days post-cast removal with the current limitations. And as for the shoulder, the limitations are flexion only to 90 degrees, shoulder abduction to only 90 degrees, internal rotation to 60 degrees, and external rotation to 30 degrees. The pain level at the shoulder is minimal, just 3 or less over 10, and it feels stiff more than painful. Could not lift arm much due to weight of the cast. On the other hand, elbow has 15 degrees of range of motion about the 90-degree point. The pain levels are 7 to 8 over 10 at the elbow. Wrist has 15 degrees flexion and extension each. It too feels very stiff rather than painful. And to start this mobilization for the upper extremity, I'll be demonstrating the mobilization for the shoulder. So what you can see now is my patient with her right shoulder exposed, and I'll be going there to demonstrate to use some passive motion to increase the flexion, abduction, internal and external rotation, and then followed by the appropriate mobilization methods. Okay. For the flexion, if the therapist or the performer is comfortable from this position, she can or he can do this from the original position to the available range, just to assess the shoulder. And if the patient is complaining of any pain going up to the 90 degrees, it's probably advisable to start from small amplitude of motion as for grade 1, in which you are barely moving the shoulder, and you can quickly upgrade it to grade 2, large amplitude of oscillation up to the resistance-free angles. And according to the textbook, you can move this, or you can do the oscillation 2 to 3 repetition per second. So I think I can go a little faster than this. For the grade 3, it's large amplitude going to the limitation of motion. So that will be up to 90 degrees of flexion, large amplitude. If the patient is complaining of pain, you can move it a little slower, or maybe do a little or shorter range, just enough to touch the limitation of motion. And for the grade 4, it's gonna be going to 90 degrees of flexion, but the return point will be smaller, since this grade of mobilization will be small amplitude. And a performer could change the position from here and go facing the patient's lower extremity. Large amplitude going to 90 degrees. This will be grade 4. Grade 3. I'm sorry. This will be grade 3. And for the grade 4, you can do a small amplitude. The return point will be small and to 90 degrees. And once the patient tolerates this, you can do an overpressure to stretch and increase more motion. And if you're lucky to increase the range of motion from this position, you can do a grade 4 again and returning to the original position, which is 90, and going to the gained range of motion. If the patient is getting difficult to tolerate this, you can apply a gentle traction and do the mobilization again. And according to the textbook, there are other mobilization that you could use to increase the range of motion of the patient. So aside from flexion, we'll be doing abduction. So going from here, 90 degrees, just to test the water or just to assess the joint. And if the patient is not complaining, you could go ahead and go to 90 degrees. What I'm doing right now is grade 3, large amplitude going to the end range. For grade 4, this will be small range just to 90 degrees. If still tolerated, you can apply an overpressure. If you can gain some motion, you can go stretch it, maybe 10 degrees more from 90 degrees, and go return to 90 to apply grade 4 mobilization. If the patient is getting tired or getting more agitated as to the pain, you can go back to original position. You can do grade 2 resistance free large amplitude. And you can go to grade 3 again, 90. Apply overpressure. And then grade 4, small amplitude. Okay. For internal and external rotation, from this position, 90 degrees, you can rotate this. I think the case said that the external rotation for the patient is 30 degrees, so it's not much, so it's gonna be only this range. So to assess, okay, the patient is able to tolerate 30 degrees without any pain, for example. So you can do a large amplitude. The return point could be halfway to 30 degrees, 2 to 3 oscillation, and this will be grade 3. For grade 4, 30 degrees, small amplitude. You can apply overpressure to stretch it, and then grade 4 again. If the patient cannot tolerate that, you can go to the original position and do a grade 2. Grade 3, 30 degrees. You can apply overpressure. Grade 4, small amplitude. If the patient is getting tired, you can apply a simple distraction there. Because when I tested this to my patient, they respond pretty much well with distraction. And I was still able to do more range or mobilization for them. So this is grade 4. Okay, for internal rotation, you're just going to be doing the opposite side. It's going to be going down to the legs of the patient. And the case has a better range in terms of internal rotation. I can go up to 60 degrees. And just to test the joint, it is okay. The patient is not complaining. So this is a large amplitude motion up to the end range, and that will be grade 3. If I want to go grade 4, that will be small amplitude. I can apply an overpressure to stretch it. I can go back to original position. I can apply some distraction and large amplitude or small amplitude for grade 4. For grade 2, it's going to be to resistance-free range. Okay. And aside from those, we could also do longitudinal movement coded for this area. And my hand position will be distal forearm and wrist of the patient, and my left hand will be grabbing the proximal part of the forearm and the elbow. My motion will be going to the lower extremity of the patient. So this will be the one of the methods for longitudinal movement coded. So the motion will be going to the feet of the patient. If you want grade 1, you barely gonna be doing it, or you barely gonna be moving the area. Because it's small amplitude. For grade 2, it's gonna be larger, but still resistance free. If you wanna go to grade 3, it's gonna be large amplitude up to the limit. In grade 4 will be small amplitude, still 2 to 3 oscillation, but the return point will be not to the original position. Okay, aside from this, you can also apply longitudinal movement coded in 90 degrees flexion, and this will be good since the patient already has range of motion for the shoulder. As to flexion, it's 90 degrees. So in this position, this method will be a good way to stretch the capsule. Okay, so hand placement will be right hand of the therapist will be wrist and distal forearm, and then left hand of the therapist will be cupping around the shoulder, and the movement will be going distally to the feet of the patient. So you can apply some distraction, taking up the slack and moving caudally. So that's oscillation, grade 1, you're barely doing it. 2 to 3 oscillation. Grade 2 will be larger, but still to a resistance free. Grade 3 will be large amplitude to the resistance, and grade 4 will be from the end range, and the return point will be small. Okay, aside from this, you can also do, aside from caudal mobilization, you can also do postero-anterior mobilization. So the patient could tolerate abduction to 90 degrees. You can go from there, or as for modification, for my personal opinion, it's probably better if you place the shoulder to its loose back position. So that would be flexion, up to 70 degrees, and then abduction to 90, 70 to 90, and then internal rotation. So from here, you can apply a distraction, just to take up the slack, and your movement will be going up, going to the ceiling. So it's going to be going this way, just to exaggerate the motion. So grade 1 will be barely doing it. Grade 2 will be large, but still to the resistance-free range. Grade 3 will be larger to the limit, and grade 4 will be to the limit. It's going to be small amplitude. The return point will be shorter. Okay. And aside from that, we can also do a posterior or anterior-posterior mobilization. And my hand placement will be here, patient's wrist, distal forearm. My right hand will be around the proximal part of the humerus. Okay. Personally, I want to apply distraction initially, and then push it down. Our motion will be, or mobilization direction will be going down. So distraction, grade 1 would be very little. Grade 2 will be larger. Still resistance free. Grade 3 will be to the limit. And grade 4 will be to the limit. The return point will be shorter. And there you go. Okay. I chose the caudal longitudinal movement caudad to increase the stretching of the capsule, and also the abduction of the patient and flexion. But I think the more appropriate mobilization technique to increase the internal, external rotation, as well as the flexion of the patient, will be the posterior and anterior glide. And according to concave and convex rule, if you use the posterior glide, you will be increasing the internal rotation and flexion, while when you use anterior glide, you'll be increasing the external rotation and extension of the patient, wherein, you know, in this case extension wasn't included. So the following videos will be in continuation of this assignment. That will be mobilization for the elbow.